Hello, everyone. Welcome to our presentation on narcissistic personality disorder. Narcissistic personality disorder is what we chose to do our presentation and fact sheet on for the mental health section. Like I said, our topic is narcissistic personality disorder. You will see this referred to as NPD throughout our presentation. So just wanted to mention that. Before we begin, we're just going to introduce ourselves. My name is Sarah Houchin.
I'm Shauna Dowling.
My name is Akita Green.
And my name is Lauren Lever.
And my name is Julia Seymour.
All right, so we're going to go ahead and get started into narcissistic personality disorder. To begin, we have a client introduction. This is where we kind of made a client based on someone that would be characterized as having narcissistic personality disorder. Our patient's name today is James. As I said, he has been diagnosed with NPD. He is 32 years of age, and some comorbidities that might be present and that are present with James and in someone that may have NPD are things such as mood and anxiety disorders, OCD, generalized anxiety disorder, and sometimes you can see a little bit of presence of alcoholism or someone being an alcoholic just because they tend to have some substance abuse issues as well associated with narcissistic personality disorder. In our case, our patient James, he is a lawyer. He is also a part-time professor. He is engaged and has a fiance. He's also a dog owner and then obviously a coworker at work, and he has his friends and family. He does live in Los Angeles, California in a 4-bedroom house with his fiance, as mentioned before. And some impacts on James, the client. What we found the biggest impact with somebody with narcissistic personality disorder would be that their social interactions are really negatively affected. They have a hard time in their personal relationships, in their work relationships, family, friends, everything like that. They have a really hard time maintaining healthy relationships and just having a positive effect on other people because they can be so conceited and self-portrayed. So the biggest impact on our client is going to be social interactions. All right, so getting into it, there is a specific way to diagnose somebody with NPD. Like many other disorders, NPD is diagnosed using the DSM-5, which is a criteria that somebody has to meet a certain amount of these criteria and these lists to be diagnosed. This is what a medical professional will use to diagnose an individual with a disorder such as NPD. So as you can see, this is taken straight from the DSM-5. It lists out the different criteria. It does define NPD as a pervasive pattern of grandiosity. Someone has a lot of need for admiration. They lack empathy. It can begin in early adulthood and is often a result of some childhood issues. But as we can see, there's 9 different numbers listed for criteria to diagnose someone. And from this criteria, the patient must present 5 or more of the following symptoms. So you can see those below, and a clinician would use this to diagnose someone. And again, they would have to present at least 5 of these 9 symptoms.
So to get into a little bit of the etiologies and facts, statistics about narcissistic personality disorder. So it is a combination of different personalities and an overemphasized idea of self and disregards towards others and their feelings. It's basically putting themselves and their feelings more, thinking themselves and their thoughts and feelings matter more than others. It can be developed by dismissal in early childhood or extreme praisal to a child, and even abuse during childhood. And individuals may struggle with significant physical and mental comorbidities, and including substance abuse, mood disorders, and anxiety disorders. So 40.6% are mood disorders, 28.6% of anxiety disorders. Substance abuse 40.6%, mood disorders 28.6%, and 40% are anxiety disorders.
So I'm just going to talk about some signs and symptoms that can be displayed with NPD. So we can see that some people with NPD will display grandiose behavior, feelings of entitlement, arrogance and superiority, lack of empathy, need for admiration or special treatment, struggling maintaining their relationships, impulsivity, lack of interpersonal vulnerability, fear, anxiety, emotional dysregulation, depressive tendencies, self-serving and self-enhancing manifestation, hypersensitivity, and fragile sense of self. So now I'm going to talk a little bit about disease management and medication management. So currently there's no medication that can specifically treat NPD, but we do see that talk therapy, also referred to psychotherapy, is the biggest use of treatment for people with NPD. And while this treatment could take a little while for the patient to see any enhances with their symptoms, it is the biggest use for the person to help them regulate their feelings and control their self-esteem and make lifestyle changes to promote their lifestyle and then also help balance their life.
Okay, so I'm going to talk about the implications for occupational performance as found in the OTPF. It defines values as beliefs and commitments about what is good, right, and important to do. So individuals with NPD may have a skewed perspective of normalized values and place themselves higher than others. In the case of James, we would see things like him not listening to what other people think, or always thinking that his opinion or what he thinks is correct and right, and not having any regards for how anybody else feels. So he would value his money, his job, his appearance, himself over others and their opinions, because that's how he feels. He feels that his opinion and everything that he believes is top tier and higher than what anybody else believes in. These values that he believes are better than anyone else's affects his relationships with his fiance, with maintaining friendships, with relationships inside the office, in the workplace, because he doesn't want to share in the experience of others or listen to what others have to say. Nobody really wants to have any type of conversation or any type of relationship with him. I'm sorry. Another implication for occupational performance is social interaction. So as Sarah stated, this is one of the biggest implications for individuals with NPD because they are incapable of initiating and terminating social interaction. So what that means is they find it very hard to start and end conversations because they want to talk about themselves only and not be part of a collective or collaborate with others. So in James's case, he has no regards, or he doesn't care about what his coworkers think or their conversations. He would interject with just about what he's feeling, what he's thinking, what's important to him, and not what's important to anybody else. So some of the things that a person with narcissistic personality disorder would exhibit would be a sense of entitlement. He, or in James's case, needs to constantly be reassured or told that what he did is good or great, because without that, he feels lower than others. So he constantly needs that satisfaction that comes from being told he did well, he did great, he's better than everyone else. Those types of things affect his group work and collaborations because no one wants to work with him because he feels that he's always better and that he always needs to be the best and doesn't take into account what other people are feeling, which makes it difficult for him to maintain relationships, especially in work, but also outside of work, because no one wants to interact or have any type of meeting or anything with him when they're not forced to at work. The last implication for occupational performance that we found is roles. So in the OTPF, we found that roles is defined and shaped by culture and context, which are defined by the client and the occupations they choose to participate in. And NPD can negatively affect an individual's roles. Specifically, James has difficulty with performance pattern roles. So his role as a fiance, friend, son, and brother are all impacted because he doesn't take into account what they feel or what they believe. So specifically with his fiance, he doesn't take into account her needs or what she would like to do. It's just what he wants all the time. As a friend And son and brother, similar. He doesn't take into account what his friends might need, or if they're feeling a certain way, or if his parents need something. It's always what he wants, what he thinks is best. He speaks over them. And so that creates a rift in their friendship and their relationships, because he's constantly trying to be better or show that he is better than his counterparts.
So now we're going to talk about how occupations can be affected by narcissistic personality disorder. So one of the occupations that could be affected is sexual activity. And in a study done by Day et al., they saw themes of infidelity, pornography, addiction, inappropriate sexual behavior, and sex addiction among those that they interviewed that were diagnosed with NPD. In another study, they found that there was a strong propensity for sexual promiscuity among those with NPD, and that could lead to future problems such with health problems such as like STDs, and it can also lead to problems with relationships, which we'll talk about a little bit on the next slide. So another occupation that can be affected by NPD is social participation. So some of the signs and symptoms of NPD, such as lack of feeling for others, lack of empathy, grandiose behavior, a sense of entitlement and superiority, these may affect the person's ability to make and maintain their friendships and also their intimate partner relationships. Another occupation that could be affected is financial management. So in the study done by Day et al., they also found a theme of financial burden among those who are diagnosed with NPD. And this could lead to impulsivity, which may increase the spending and lead to more impulse buys to keep up with this idea that they need to be the best. This could cause problems with the IADL financial management.
So some interprofessional care for people with narcissistic personality disorder. So for one, there is a psychiatrist, just a medical doctor who can help diagnose, educate, and help create a plan of treatment for someone with NPD. There's also a schema therapist who is commonly used to treat NPD, which focuses on the patient's primary needs, limiting reparenting, activating emotional, cognitive, and behavioral techniques, and addressing maladaptive coping strategies. And then CBT, or cognitive behavioral therapy, which is used to help ease a patient's struggles and symptoms by gradually exposing them to certain situations and having them adapt and form new behaviors, which focuses on being less impulsive, more understanding, and learning techniques to cope with situations when they do not get their way. So overall, really just helping them with their own feelings, accepting others and other people's problems, being able to listen, becoming more aware and understanding that other people in their lives matter too, just as much as theirs does as well. And that is the end of our presentation. Thank you.